Welcome to the Department of Health and Human Services. I'm here today on behalf of the White House Domestic Policy Council to share President Trump's strong support for families, for marriage, for building a culture of life that values both mothers and children, born and unborn, at every stage of life, and our commitment to reversing the fertility crisis in this country. Mothers are the heartbeat of that most fundamental of institutions, the family, and the unconditional love of a mother for her children is one of the most powerful forces in the world. This administration celebrates mothers, and we even know what a mother is, something our prior administration did not acknowledge. And the greatest blessing, that is our children. We also recognize the challenges many mothers face during their pregnancy journeys, particularly when the pregnancy is unplanned. Every woman deserves support as she prepares to welcome that child growing within her into the world, no matter the circumstances. That's why, as President Trump announced this morning, Moms.gov is so important. This new website empowers new moms with access to practical information and supportive services that care for her and her baby. The website has important information for a new mother, like how to find a pregnancy center or a federally qualified health center in her zip code, nutrition information based on the new dietary guidelines, Trump accounts, preconception health, Trump RX, breastfeeding, mental health, adoption, and more. We'll hear more about that from our panelists who will speak more to these issues. But we salute the work of more than 2,700 pregnancy centers throughout this nation that provide pregnant mothers and their families with free supportive services, ultrasounds, parenting classes, pregnancy tests, diapers, formula, and more. Often this work goes on without celebration, without recognition, but we hope to change that today by recognizing their critical work for our nation and for pregnant mothers around our country. So this website is something that pro-life and pro-family advocates, including leaders on Capitol Hill that we'll hear from, have sought for many, many years. And we're proud of Secretary Kennedy and for his team, and especially thank Natalie Dodson with the Secretary's office who worked so hard on this, for giving this Mother's Day gift to new mothers everywhere. So to the women facing difficulties in pregnancy, you're not alone. With Moms.gov, your help is just a click away. So thank you very much.
Good afternoon, everyone. Can you hear me? Yes. Okay, great. Well, we're really excited to join all of you today and to support mothers, and excited about the launch of Moms.gov. If you don't believe me, President Trump this morning said everybody should check out Moms.gov, so I really encourage you to do so. And we're going to do a little demo of the website. If you haven't checked it out yet, I'm going to show it to you, and we're just really excited to share this new resource. So without further ado, Moms.gov is really a resource, a platform for women and fathers and families that need resources if they're facing difficult pregnancies, or if they just need to know what information is out there for pregnancy and for new motherhood. So 2 of the resources that we're highlighting are pregnancy centers. Pregnancy centers really offer support services through free diapers, free clothes. They have pregnancy tests and oftentimes ultrasounds. And then federally qualified health centers are funded by HRSA, and they are a broad range of care services. They have OBGYNs and pediatric services. So these are really 2 great resources for moms who are seeking support and clinical services. As you may know and may be aware of, HHS released its new dietary guidelines for Americans at the beginning of this year. And there's sections for pregnant women and for breastfeeding women on the DGAs, and so we really wanted to highlight those new resources, especially as we're working to make America healthy again. We have Trump accounts, which starting July 4th, you can submit and enroll your children or eligible children into Trump accounts, so you can get $1,000 into an account that they will be able to access at 18 years old. Of course, there's Trump RX, which President Trump is very excited about, and we're very excited about, and they have some of the lowest prescription prices for fertility and weight loss medications. And then we have a whole range of services and resources on preconception health, breastfeeding, nutrition, mental health, adoption, and of course, early Head Start. And then if we scroll a little bit further down, you have additional resources on your conscience rights as a mother, as a father, sleep safety, substance use, infections, and health conditions, and then additional exposures and environmental exposures. So this really marries some of the MAHA agenda and also some of the pro-life asks that we have seen for many years. So we're very excited about this website. Thank you all.
Well, good afternoon, everybody. My name is Alex Adams. I'm the Assistant Secretary for the Administration for Children and Families. So I will say it is great to see so many children and families in this audience. I love seeing the kids, so certainly thanks for bringing them and thanks for making this a family event. Earlier this morning, I had the pleasure of joining President Trump in the Oval Office where he unveiled Moms.gov. This is a president who has put children and families first. And as I told him, I said, when history records that American families needed a champion, he was there. So this is a website that's getting attention at the highest levels. Congratulations to President Trump and Secretary Kennedy for prioritizing this. At ACF, our role in this is primarily driven by childcare. There's going to be folks talking about preconception care, birth, things like that. My role is childcare affordability, so I'll talk a little bit about that. But before I do, I also wanted to just share the story I shared with President Trump at the Oval Office this morning. There are many ways to have a family. Adoption is one of them. Foster care is one of them. My family's journey was through IVF. So we prayed many nights to be able to have a child, and through the miracle of IVF, we were able to bless and bring our daughter Emerson into the world. So I know you'll hear later today about some of the things the administration is doing on fertility and IVF in particular, and I couldn't be more than proud to represent this administration. On child care, what we announced today is first recognizing the reality for millions of Americans, and that's for many with young children, child care has become too expensive, too difficult to find, and too disconnected from the needs of working families. And in previous administrations, the answer was always the same: more federal mandates, more bureaucracy, and higher costs for everybody. Under President Trump, we rolled out 2 new regulations today and 2 new guidance documents that put parents back in charge of their child care. And we're doing 3 things. First, we're restoring parental choice. Yeah, that means bringing faith-based providers back to the marketplace, and it also means recognizing that child care doesn't just mean center-based care, that there is an absolutely vital role of home-based providers, relatives, and very importantly, mothers who choose to stay home with their children during the child's earliest years. We're putting all of those on an equal playing field and recognizing that too often that there's been barriers to all of those providers participating in federal programs. Secondly, we're going to cut unnecessary red tape that forced providers to close their doors, limited access to care, and made it harder for working families to afford care. Too often, there's been a tendency to have one-size-fits-all federal mandates that direct families to government-preferred options rather than recognizing those faith-based providers, relatives, or mothers staying home with their own children. And then third, we're going to strengthen accountability. I joked, if you followed some of the news earlier this year about some of the Minnesota daycares, I can say there are more kids in this room than some Minnesota daycares. And we think American taxpayers deserve better, and we will strengthen program integrity to ensure our dollars go to those who need it most. So from ACS perspective, we look forward to working with you all to ensure after birth that the full suite of child care options is available to every new family, and we're going to make more affordable options, more providers, more choices for parents, and more accountability for taxpayers. And our 2 rules went live today, and our 2 guidance documents went live today. So you can rest assured both President Trump and Secretary Kennedy mean what they say and say what they mean, and we're going to push hard and aggressively to deliver that for all American families. So thanks for the opportunity to be here with you today. thanks for what Moms.gov does and the whole suite of services that you'll hear about today. I think this is going to do incredible things for children and families throughout the country. So honored to be a small part of your agenda. Thank you all.
Administrator Alex Adams, you're right. Strong families build a strong nation. And you are definitely doing that through ACF with the leadership of Secretary Kennedy, of course, our president, in making a family more affordable. Well, I'm Dr. Stephanie Herodopoulos, and I'm a family medicine physician that has the honor to work alongside a great group of HHS leaders here. I serve as Principal Deputy Assistant Secretary Health and Policy in OASH and was Chief of Staff at the Office of the Surgeon General. And today I have to introduce my husband, Congressman Mike Herodopoulos. He is in the front row. He is also very much a pro-family supporter and is working in his own skill set to make affordability for our nation. We have 3 wonderful grown children. So I speak to you as a mother and a family medicine physician today, and I get to be the moderator of this panel. So everyone's going to have about 5 minutes, and I'll be moving along. We have some exciting guests coming, and as they show up, I'll introduce them. But as we embark on the National Women's Health Week in the heels of Mother's Day, what an amazing, wonderful announcement to make with Moms.gov. And it's a one-stop shop with a resource for so many nuggets of great information for women and families to have to look, and so they can make sure that they have everything that they need. And this is built on a response from requests from members of Congress, like the wonderful Congresswoman to our left, and stakeholders who recognized that the need of a single accessible place where pregnant women and new mothers can find the support they need and recognize that women's lives matters. And you're going to hear so many wonderful speakers today talking about that. But this is a life-affirming, pro-family website with a MAHA spin to it, and one that supports moms who want to live healthy for themselves and their babies, for nutritional guidance to breastfeeding support to preconceptual health, and mental health and adoption services and Head Start. You're gonna just love it if you haven't perused through it yet. But with that, I'd like to get started. And so for the first panelist that we have, I'd like to introduce Administrator Tom Engels, who is the head of Health Resources and Services Administration. For those of you who don't know, federally qualified healthcare centers fall under his purview, and there are about 1,400 of them, and all the programs combined within HRSA service 600 million pregnant women, infants, and children. So with that, Administrator Tom Engels.
Thank you, Dr. Herodopoulos. I just want to clarify something in case anybody's confused. I am not a mother. I cannot be a mother. But I am a truly good father to 3 grown adult children. And I have 2 wonderful grandchildren, that is a 2-year-old and an 8-week-old, that I truly am very proud of my daughter and the great mother that she has become. She's a stay-at-home mom, but the great mother that she has really become. I came back to HRSA this time because I wanted to do something different. I wanted to be the administrator of the Health Resources and Services Administration, and this time under my mission, I wanted to look through my grandchildren's eyes to try to imagine all the decisions that I'm making to see and make sure they are being reflected upon and that they are being considered when I make those decisions. And I want to know 4, 5, 50 years from now how those decisions are going to impact them. But good afternoon, and I want to say Happy Mother's Day belated to all the mothers in the room. Thank you for what you have done. There's no better way to talk about what it means to support the American mothers, and it's not just words that we're talking about today. At the Health Resources and Services Administration, supporting mothers and babies is central to everything that we do. Healthy moms are the foundation of the healthy families, strong communities, and better quality of life across a lifespan. Today, I want to share some of the ways that we are working alongside our partners at the health centers across the country to make their lives better. Let me start by the backbone of the health center program. HRSA, as Dr. Herodopoulos mentioned, HRSA funds approximately 1,400 health centers operating more than 16,000 sites in every state, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Basin. These health centers serve over 32 million patients, including 1 in 5 children. I'd cheer too if I was you. 1 in 5 living in rural communities, 1 in 8 children living across the country. They are often the only affordable source of health care for these families. In 2024, over 600,000 patients received prenatal care from a health center provider. Of those, more than 70% began receiving their care in the first trimester at a health center. That early entry into prenatal care is critically important for healthy pregnancies and healthy babies. Health centers also performed nearly 175 deliveries last year. And because we know that mothers' mental health is just as important as their physical health, health centers have made significant strides there too, where 87% of patients were screened for depression and received follow-up care from a health center. A powerful example is what looks like to integrate mental health into the primary care is the right way to accomplish this. Access matters, but so does quality. That's why HRSA invested almost $65 million to improve mental health care with a focus on patients at the highest risk of maternal morbidity and mortality. These health centers have been doing remarkable work, providing group education and support, integrating behavioral health, managing chronic disease and complicated pregnancies, and deploying expanded care teams, including community health workers and behavioral health specialists. They have also expanded access through telehealth, mobile units, and home visits, meeting mothers where they are, literally. I want to highlight Denver's health workforce area. They launched a remote patient monitoring program for real-time blood pressure oversight and prenatal parent rights, enabling early intervention and following up on leading causes of maternal mortality, which is hypertension. Over 2 years, Denver Health has significantly increased a rate of prenatal patient care. Beyond health centers, one of HRSA's most powerful tools for maternal health is the Title V Maternal Health and Child Services Block Grant, our flagship investment that reaches 92% of pregnant women nationwide. Through Title V, HRSA partners with every state and jurisdiction, giving them a flexibility to identify the most pressing needs and tailor their solutions to their communities. In many places, Title V supports prenatal and postpartum care, funds community health workers, and provides education, screenings, and referrals to mothers facing barriers to care. That same infrastructure supports rural referrals and home visits. Speaking of home visits, HRSA's Maternal, Infant, and Early Childhood Home Visiting Program, known as McV, is one of our most personal and powerful investments for mothers. Home visits services operate in more than 1,200 counties across the country. Each year, home visitors make more than 1 million house calls to provide hands-on support to pregnant women and new moms. Home visitors help families stay connected to prenatal and postpartum care, support breastfeeding, recognizing the signs of postpartum depression, and assess families' broader needs, connecting parents to services that help build stable communities. I want to thank all the mothers again for everything that you do. You are your child's first teachers. And because of your efforts, our children are going to grow stronger, healthier, and make this nation stronger. We are meeting President Trump's goals and Secretary Kennedy's goals of a great American recovery through the programs that I just announced. So thank you for this opportunity.
Thank you, Administrator. I had the honor of working with Administrator Ingalls earlier in this year when we added 2 muscular dystrophies to the newborn screening panel to help save the lives of babies that are born. So I want to give another round of applause to him for that. That's a big deal. So next up, we have a Gen Z podcaster named Isabel Brown, who's also a new mom. She has, oh, we got the hands in the back, a 1-year-old as of last week, and I know she's got a lot to say. So with that, Isabel Brown.
Wonderful. Thank you so much for that beautiful introduction and the opportunity to join you all today. Again, as was mentioned, my name is Isabel, and I wear a whole lot of different hats these days in Washington and outside of Washington, but mostly as the host of a daily social media-based podcast called The Isabel Brown Show with Daily Wire, in which I am tasked with traveling the country and engaging in the digital space and boots on the ground with members of my generation, the dreaded Gen Z that's destroying American society, although not if we have anything to do with it. I really truly believe this generation will save our country from the brink of destruction, but only if we're willing to tell our generation the truth. And most importantly, I am a mom to a beautiful little girl named Isla, who just turned 1 about a week and a half ago. It has been the most beautiful journey of my life, getting to share my walk through motherhood with my community, and I can't wait to continue growing our family over the next few years. What's interesting to me beyond anything else I've encountered as a Gen Z content creator and speaking on college campuses alongside friends and mentors of mine for the past several years like Charlie Kirk is that there is one topic that most people, especially young women, seem to be the most ferociously passionate about in American culture today. And it's something that Washington, D.C. often turns a blind eye to or thinks is far too controversial for us to ever conduct conversation about in polite society to begin with. And that is the abortion industry's normalized culture of death that has taken hold of our generation in far more dramatic ways than most people may realize. Did you know that it's Planned Parenthood who is tasked with writing most of the sexual education curriculum for public schools across the country, directly impacting young children age 10 or 11 in their elementary school classrooms with the idea that it is the death of your children that is appropriate sexual health care, and it's something you should always hide from mom and dad. It's Planned Parenthood that is promoting the chemical castration of teenage girls, making sure that you will never have the opportunity to naturally conceive a child in the first place, as they have become the #2 provider of cross-sex hormones and puberty blockers for teenage and adolescent girls across our country, especially in the wake of the Dobbs decision and realizing they need to change their business model a bit to keep the lights on. And of course, it's Planned Parenthood telling the women of my generation that the only way to be enlightened, successful, a true feminist, or somehow equal to men is to sacrifice our children on the altar of the abortion industry so that we can climb the corporate ladder or continue having meaningful friendships, have as many boyfriends as humanly possible before we turn 30, and certainly never settle down with a man long term. And it's for these reasons that we have created a widespread culture that is oriented towards the intentional destruction of the family in Western civilization. It's why we have the lowest marriage rate in America today ever recorded since we began recording those rates in the 1860s, and a record low fertility rate in which we aren't facing a massive overpopulation crisis, as you'll often hear on CNN or MSNBC, but a dramatic underpopulation crisis in which we cannot sustain the human population for nearly 2/3 of the world's people scattered across the globe. Open social media, and it's even crazier, the conversation that you see conducted among my generation, because of the sheer number of lies perpetrated by the public education system, by most of the public health experts in our society today, and what's considered vogue in women's publications and magazines. One of the biggest trends that you see on social media today is called the girl with the list, listing out hundreds or thousands of reasons every single day why pregnancy, childbirth, and raising a child is beneath you as a woman, and cataloging all of the reasons you should never want to do it in the first place. Just before the 2024 election, it was the Los Angeles Times that ran the headline, "It's almost shameful to want to have children." They, of course, were referring to the climate change argument, but I've seen it twisted a million which ways from Sunday ever since then, with just recently New York Magazine running an entire portfolio called I Regret Having Children, featuring young women who express profound regret for the ability that they had to bring new life into the world. And one story in particular of a 27-year-old mom of a 1-year-old in North Carolina who is now abandoning her son and leaving her husband, who has assumed full custody of their child, so that she can pursue radical selfishness, or what I often call malignant narcissism, in chasing true feminism in our culture today. All of this has culminated with a shocking and scary reality that I think most of our lawmakers and policymakers here in DC are truly unaware of. By 2030, in just a few years, 45% of 25 to 44-year-old women are expected to be single and childless for the first time in American history. What's scary to me as a former biomedical sciences nerd and student with my undergraduate and master's degree pursuing a career in medicine before God took my life in a different direction is just how far medical experts have gone to perpetrate the lie as well, until we've had this incredible administration willing to tell the truth. At the end of the last presidential administration, it was the Surgeon General who issued an official public health warning that parenting is dangerous for your health, because it has so much mental strain and so much emotional toll on your life that you'll be more lonely the more people you end up bringing into the world. And yet, we know that none of this is true. The Institute for Family Studies just recently released incredible data showing that for women under 35, those of us who are married with children are 3 times happier than our unmarried and childless counterparts. And for men, that's a 2.6 times gap as well. We're watching a fascinating conversation unfold, but we have to remember the cultural continued fight to reinstate the truth to our generation that motherhood is not a death sentence and babies are not a burden. It is always a blessing, but requires a radical overhaul of our death culture that has been normalized across our country to build a culture of real health and life. Moms.gov is an incredible new step in that direction, and I'm incredibly honored to know that we have a generation with access to things like pregnancy health centers, pregnancy resource centers, federally qualified health centers, and so much more. But I hope that this is just the beginning of the conversation, because the work cannot end here. Yes, last year 600,000 patients were treated at a federally qualified health center, but we had a record high number of abortions in our country, even after Roe v. Wade was overturned, with 1.2 million abortions in our country, 70% of which happened at home without doctor supervision, usually from pills that were distributed through the mail without a doctor ever having to confirm that you were pregnant to begin with. I hope this creates a conversation for us to reinstate important REM qualifications on abortion medication, to engage in environmental testing for the active metabolites in abortion pills that we know are in our wastewater and drinking water. Maybe we can continue clearing the financial pathway for young families to buy new homes instead of wondering if we'll ever get a chance for that slice of the American dream for ourselves. We sure as heck should change our education policy and make sure it's not the abortion industry teaching our next generation about intimacy and addressing these underlying causes of infertility. But I'm incredibly grateful for President Trump, for Secretary Kennedy, for everyone on this stage, that together we can continue to link arms to speak the truth and to generate a culture of life for Gen Z rather than a culture of death. Thank you for having me.
Thank you, Isabel. Well said. Well, next on the list is Jarrell Godseed, president of Heartbeat International, overseeing, I believe, the option line, which coordinates a lot of the directory for the public health pregnancy resource centers. So I'd love to hear from you. You're up.
Thank you, Doctor. It's a privilege to be here, and especially the day after Mother's Day, where we all took time to celebrate our moms. I'm just making a note here right on the table amongst all these flowers is something that we call baby's breath, and I think it's just particularly special for the time as we get to talk about moms and babies and how special they are. Pregnancy help centers didn't just show up. We've actually been around for more than 50 years, standing in the background, serving in communities all across the United States. There are nearly 3,000 pregnancy centers that are serving in communities, large and small, in ways great and small. Some are as simple as a small building, a few rooms that are able to help people walk through their situation, their personal situation. Others are those that have great medical services, are providing many different services, many variety of programs, and about 70% of them are actually providing ultrasound. And one of the most amazing things is that they do this because of the kind support of their local community. And in the most recent year when we counted them, we actually were able to serve more than 1 million moms across the country for the kind goodness out of the hearts of those that said, yes, we need a place for life-affirming care. We need a place where they celebrate motherhood, where they encourage her in that situation, because even this day after Mother's Day, there are women that will wake up all across this country. The statistics tell us it's about 3,000 every single day who wake up and they're not sure that they want to be moms, even as they find out that they are one. And that's what pregnancy help centers have been all about, helping serve women, step into those situations, walk through those very temporary moments of fear and concern, and help see what really lies ahead, help them show that there are those in their community willing and ready to help them every single day. And at Option Line, we get to answer those calls all day long, every day, even on holidays. We had calls yesterday for Mother's Day, a special time for us to take that. We get calls throughout the holidays of Christmas and of Thanksgiving. Some of our biggest times, our busiest times are during those holidays. And we're delighted to be able to partner with Moms.gov, with this administration, because truly we cannot make America great again or America healthy again if we do not focus on our mothers and focus on moms and help moms do what they are called to do, help them do what only they can do, help them step into the lives of their children and say yes to these precious gifts that come from God in heaven. We're grateful that this administration recognizes the importance of that. We're blessed that we're able to stand here and be a part of this group and say yes to our friends here who are saying yes to moms and being part of Moms.gov, and answer those calls every single day. It's our privilege to do that. It's our opportunity to do that. We do that out of the kindness of those that help us do so. And we're grateful when a country stands up and says, yes, our moms are special, our moms are important, because that's how we all got here, was through our moms. And so we're grateful to be here and be a part of this. Thank you very much.
Thank you, Darrell. Next on the list is Dr. Dorothy Fink. She, for those of you who don't know, she was the acting secretary before Kennedy was sworn in, as well as the acting ASH and now principal deputy assistant secretary of health. She was just standing behind the president today at the White House talking about her work with the perinatal collaborative. She's going to give you some amazing announcements today. I get to work with her every day. I'm always impressed with her knowledge and what she's done. And she started something during the first Trump administration that she's going to talk about, and seeing the results of the impact on a community granular level. So with that, Dr. Fink.
Oh, thank you so much, Dr. Herodopoulos. It's wonderful to be here with all of you today. First off, happy National Women's Health Week. And I'm thrilled to share more about what we do in the Office on Women's Health and the Office of the Assistant Secretary for Health. Earlier this year, we held the first ever National Conference on Women's Health, where we covered a myriad of topics, everything from decreasing time to diagnosis, to menopause, to invisible illnesses, and to our topic of today, maternal and infant health. And it was during that meeting we announced a partnership with the Preeclampsia Foundation, where we're really going to focus in on how do we ensure that women, even after delivering a baby, have the best care and get diagnosed early on when they have high blood pressure after delivery? So many times, we have these dogmas in medicine where we say, oh, well, once the placenta is delivered, any hypertension that occurred just magically goes away. But we know that's not the case. And so with the Preeclampsia Foundation and a number of other organizations, we're really focused in on how can we ensure that women get information, and when they go to see their doctors and go to the hospital or wherever clinic they go, are identified as being high risk for having high blood pressure after delivery, and get the care that they need to have the best life possible and the best health possible so that they can care for their baby for years to come. And so we were thrilled to announce that partnership with the Preeclampsia Foundation during the National Conference on Women's Health to really bring light to cardiovascular disease and pregnancy. During that meeting and over the coming weeks and months, we've also been really thrilled to share more data about our perinatal improvement collaborative that we began under the first Trump administration, where we said, we really want to ensure that all hospitals across America have the best quality improvement initiatives possible, so that in the end, for every woman who delivers a baby in the United States of America, they have the healthiest delivery possible. And so we were able to recruit over 200 hospitals, and for a number of years now, we've been working with them to implement quality improvement interventions. And I'm thrilled to share with you all today that in the hospitals that are part of our collaborative, we reduced maternal mortality, and this is for visit mortality. So when you're in the hospital delivering a baby, we've reduced maternal mortality by 41.5% in the hospitals that are part of our collaborative. And we compared that number, yes. It's really amazing, and so much times in public health we talk about the maternal health crisis, but we want solutions, right? And that's what we're here today, and we're always willing to engage with anyone who can help us come up with solutions to ensure that women who are going through pregnancies have the safest deliveries possible and the best postpartum care possible. And so when we had that 41.5% decrease in maternal mortality in that group of 220 hospitals, we compared that to a bench group of similar hospitals over the same time, where their maternal mortality rates only decreased by 5.9%. And so it's incredible to see how these quality improvement interventions can lead to such incredible outcomes for moms' lives. And we're really thrilled that we are announcing another MOU with Heartland Forward to really expand this work and ensure that every hospital across America has the best quality improvement possible. And in the end, we want to ensure that when our moms go home from the hospital, that they have decades and decades with their precious children, because it is such a miracle of life. And we appreciate, all of the struggles that lead many women to go through the process of, going through infertility, getting answers, and getting to the point of going through a pregnancy. We want to ensure that those pregnancies are the healthiest possible, and we're thrilled that we're going to be able to look to expand this to every hospital in the U.S. And so I'm thrilled to introduce to the stage Olivia Walton, who we're partnering with to expand this work through Heartland Forward. And so I'll ask her to come on up and share more about our work together.
Thank you very much, Dr. Fink. Good afternoon, everybody. It's a pleasure to be with you this afternoon. The Department of Health and Human Services does so much good work to support the moms and babies of America, so thank you. Whether it is TEMA, whether it is the Office of Women's Health, whether it is at CMS, there is so much good work going on. And so it's really thrilling to come alongside as the private sector and figure out ways in which we can work together and amplify outcomes for moms and babies. So I'm here on behalf of Heartland Forward. Heartland Forward is an economic development organization that our family started in our hometown of Bentonville, Arkansas. We do economic research, we do convening, and we do state policy advisory. We have a program called the Maternal and Child Health Center for Policy and Practice, which I founded a couple years ago. We work with states to help them improve their maternal health outcomes. We are now launching Healthy Moms, Healthy Babies America, a 5-year sprint to cut the U.S. maternal death rate in half. It sounds audacious, but I am confident we can do it. Why? Well, because we have the federal spotlight, thanks to incredible federal leaders like Dr. Fink, like Secretary Kennedy, like Dr. Oz, and like President Trump, who want to make America the best place to have a baby. We also have funds to do it. We're very optimistic that we can leverage the $50 billion of rural health funds that are going out to states right now to incentivize states to actually improve maternal health. And to Dr. Fink's point, we actually know what works. The vast majority of maternal mortality and infant mortality is preventable. We really know how to do this. Now, I'm a mom of 3 little kids. I live in a rural state, Arkansas, and we have some of the worst maternal mortality in the country. You've got moms driving for hours trying to get to the OB. They don't have the time to do that. They often don't have the money to do that. And then after they've had the baby, they're not going back for any kind of checkup. So I was excited to hear the administrator talk about the efficacy of the home visits because they're a really critical, valuable intervention. But we have got moms at home not getting any care at all, and this is a huge opportunity really for the country, I believe. You know, what does this look like? It's moms dying of cardiac issues that could have been caught. It is moms dying of hemorrhages that could have been stopped if they could have gotten to a hospital. And it is hundreds of thousands of American moms dealing with mental health issues, postpartum depression, anxiety, addiction. All of that stuff we can deal with. And by the way, it doesn't just have to be doctors. We've got midwives, we've got doulas, we've got family practice doctors that can expand their scope of practice. There are a lot of other ways to reach these moms, including virtually, as the administrator said. So we really have the solutions. And what we're doing at Heartland Forward is we are uniting policymakers with business leaders, with faith leaders, and healthcare providers all around this one goal. Today, this memorandum of understanding that we're announcing with HHS, it is really just an honor to come alongside the great work you're doing. I mean, imagine that, cutting the maternal death rate by over 40% with one program. How quickly can we sign up for that? I mean, it's just crazy. So we are going to work as Heartland Forward on several convenings with HHS to get the right stakeholders in the room to make change, and we're also going to do some of that research. So they actually have the data. We can measure the outcomes and add some more accountability. So that's what I have to say. And Dr. Fink, I really appreciate your leadership and inviting me here today. Thank you.
Oh, thank you so much.
Thank you.
Thank you, Dr. Fink. Can you imagine taking that collaborative of 220 hospitals and making that nationwide model? That is the goal. Thank you, Mrs. Walton. This is just incredible work for your MOU. Up next, I have the honor of introducing Katie Miller, who is carved out her own distinguished career in public communications with significant roles in the private sector in the White House, and now has a successful podcast interviewing individuals from politics, media, and business, and whom happens to be pregnant with her 4th child. Katie.
Thank you, and I'm so excited to join you all today. As the sole pregnant representative, not only on the panel, but I think in this room, I can confidently say that after my remarks, I'm going to go ahead and stand up and walk out, because if anyone who has been here knows what it feels like to be 35 weeks pregnant and sit in a chair for about an hour, you know you cannot sit any longer. I have a large baby. But no, I'm so excited to be here with you all today. A brief bit and why I feel so passionately about not only maternal health, but what this administration is doing for moms, not only in our administration, but throughout the country, is I've seen it personally firsthand. I met my husband, Stephen, through working for President Trump. We had 3 kids in 4 years, which I joke is the off season. It was in between Trump's first term and Trump's second term. And then we took a bit of a hiatus, and now we are pregnant with our 4th child in 5 years. So my kids are 5, 4, 2, and I am having a baby in, I would say, 3.5 weeks if I was being generous. And so I like to talk about this in the sense of you have to practice what you preach. So much of what is politics is people preaching and talking about these conversations without having truly lived that life experience for themselves. And what I find to be so amazing amongst the conservative movement and other moms is that you're seeing it from this administration, whether that be from Caroline Leavitt or from Usha Vance, is that no one planned it, but somehow we all turned up pregnant within a month of each other. Literally, if you look at the clock backward. And every single time that President Trump would find out that one of us were having a baby, he would look at us and just be so excited and so ecstatic for what that meant for our family. And what that means for my little kids each and every day is that once a week they join their dad at the office for lunch in the Navy mess. They find themselves down in the Oval Office walking in with President Trump, who they know as this coin man, because every time he gives them these large presidential coins. They also love going down there because, while it is not popular to say in this room, but there are cookies that sit right outside the Oval Office. And so my children know it is trick-or-treating in the White House, because not every single office you walk into there, no matter what day of the week it is or what hour of the day, kids are welcome as if it is a normal event. And I think that is lost in our society, that having kids is normal, having kids should be celebrated. It is not something that just the mom does at home. While we very much believe in that primary home duties do fall on the mother in my household, that doesn't mean it is me and me alone. It is us and us together. And so for us, that means my husband plays an active role. And as he goes to China tomorrow with President Trump, he is coming home at 5 o'clock for family dinner tonight, because family dinners are integral in our household. And if more women and more moms talked about how you live your lives, and the reason why I launched my podcast after working for Vice President Mike Pence and Elon Musk, and why I said this is so important to me and to preach about this and talk about this almost every day, is that we don't talk enough about what it means to be a working mother who lives those principles. So often it is, I am a stay-at-home mother and this is how we make our family work, but no one ever talks about the nitty-gritty of what it means to raise children while working as a full-time mother and having a supportive husband, because so often it is just this pushed upon us, this toxic mentality of saying that the woman therefore is subjugated to the man or has to stay home, when it is just not that way, and it's certainly not that way in my household. My children are celebrated, they are loved, and I think if we talked more that you can have a full-time career, you can rise to the pinnacle of your career, you can work part-time if you need to while raising those children and be fulfilled, well then you'd be incredibly successful. And I see Mehmet Oz out of the corner of my eye. Hi, Mehmet. But that is just something why I love this administration, our leaders at this department, is because not a single day has someone said you can't. They have said, go have more babies and we'll make it work for you. And that's exactly what Secretary Kennedy had done. Dr. Oz has done, who has taken my phone calls many a pregnant nights of what ultrasound should I do or not do, what vaccines I should give my kids or not give, and he will not give that publicly because he will not tell a mother what vaccine they should and shouldn't give in this position, but he will certainly tell a friend what they should and shouldn't do. When they call him and say, hello, the pediatrician says I need to give my kids a Tdap vaccine tomorrow, what do you say? And so I think there are many choices.
I tell them what my daughters do.
There are many choices presented to women across this across, I would say, our society about what vaccines you shouldn't give, what you should and shouldn't do. Should you drink raw milk? Should you not drink raw milk? And what I find so refreshing about this administration, and what I know Dr. Oz will help the CDC do, as I've been pushing, is saying that breastfeeding is best. I've been on this crusade now, and I'm not going to let up until after they change the rules that say breastfeeding is best. It is okay if you formula feed, but we should all be honest with ourselves that for the gut microbiome, breastfeeding is best. And I think that is way too long that we have not changed that from the CDC, because how can you believe medical science if you don't say what we all know in this room to be true?
Thank you so much, Katie. That's wonderful. And a person who needs no introduction, well, I guess you are the 17th administrator of the Centers for Medicaid and Medicare Services, Dr. Oz.
You're very kind. Thank you. Dorothy, congratulations. She was wonderful in the Oval Office this morning. The president took almost 2 hours today to talk about the issues that you're discussing. That's a lot of time out of the president's schedule, and that's not how long it was supposed to be. But he loved the topic so much that he stayed on it. And when we do press conferences after these kinds of announcements, it almost invariably quickly shifts to Iran, which is the topic of today. The reporters came back to this topic, which means you're on to something big. And the entire team here is dedicated with good leaders to making sure this happens. I'm going to address two topics, both concrete examples of what the administration has done to support women that might be a little bit different from what you've been hearing about. The first is most favored nation drug pricing. I apologize, I wasn't here earlier. Did you discuss that in detail? Not at all. All right. So I love babies. I really do. I always tell my daughters, when they're crying, it means they're healthy. Because the first thing a doctor learns is a healthy cry and an unhealthy cry. And babies that are sick often don't cry, or they don't cry the same way anyway. So for me, I was flying back last night from Los Angeles, and the child next seat behind me was crying, and I fell right asleep. It was perfect, because I knew usually my wife would wake up. We learned that in residency, which is when some of the kids were born. Beepers would wake me up, cries would wake her up. There's two things that the president wanted to have happen. First is most favored nation drug pricing, because and particularly in the fertility space, a third of the money spent on the entire service. It's about $6,000 per child delivered after some type of fertilization process, medical process, comes for drug prices. And that's the money that now is being taken out of the system by drug prices that are now in aggregate 1/10 of what it used to be. I'll say that again because it's so shocking you wouldn't believe it. The same Gonal F that's, let's say $3,500 per cycle in America is closer to $350 to $400 in Europe. 1/10 the price. From now on TrumpRx.gov, you're able to access that pricing, and at that pricing, the savings are so dramatic. We've had about 19,000 women use it so far, saved $15 million, but we project we will save $4.5 billion for women trying to have babies. I mean, you think that 1 in 3 women are under-babied, either, as you know, from not having the number they want or not having any babies at all. That's a huge saving to the American people. We think that'll start to push back on the rapid decline in live births that we're seeing in this country, way below the 2.1 replacement number. And Secretary Kennedy, who's coming down, will speak to some of these issues, so I won't get into them in more detail. But that number is a critical one, and please tell your friends, if you're struggling with fertility issues and you're going to use these meds, please check TrumpRx.gov for the right price before you make an acquisition. You can get coupons right off that site. There's no charge to use it. It's a government site. We built it for the American people. We are hoping to allow and free women to have the babies that they desire by making these prices affordable. The second big issue I wanted to address is the working families tax cut legislation. Did that come up so far? Oh, perhaps so happy I came. So the Working Families Tax Cut legislation, which is the big bill that we signed July 4th, the president signed it. The Congress, got on board with this. It was a very partisan vote. It's unfortunate, but that was how it came out. It put $50 billion into rural health care in America. To put that in perspective, it's $10 billion a year for 5 years. That's a 50% increase in the number of the amount of money that Medicaid is putting into rural health care, which touches the lives of about 60 million Americans. And rural America has a mortality rate, a peripartum mortality rate, that's about 30% higher than urban America. Can you even process that? Your zip code is a dramatic influence on whether you're going to survive having a baby. So this massive investment in rural health care, $50 billion, is designed by the president and Congress to allow us to experiment with new ways, better ways of delivering maternity care in rural America. And I'll just give you a couple examples. The classic one is you need more providers. You need actual people to do the job. And so we're going to help train more doctors and nurses to be able to do just that and support governors, give the money to the governors, let the governors put the money where it's best used in the parts of rural America that could benefit the most. Second thing we're going to do is push large academic centers to work more closely with smaller facilities, to adopt them. So if you're a high-volume OB center in the big city in your state, and you've not taken time to form collaborations with smaller providers that desperately want to be part of your team, we'll grease the wheels for that to happen so that the smaller providers can actually now begin to trust the larger providers. They can go to grand rounds together digitally. They can build telehealth services that allow these programs to thrive as they should have always been thriving. But, small providers, they don't always trust the big guys because sometimes they come in there and they buy your practice. They're only wanting to get your patients and they drive you out. That's not allowed anymore. Just sharing group purchasing, saving money, sharing back office programs, sharing electronic medical records. All these are things that smaller providers have a hard time doing that a major center, I'm a New York Presbyterian, I was for most of my career, we could easily share that with smaller providers in New York State or Connecticut, New Jersey, but there wasn't a reason to do it. Now there's a reason to do it, and the governors can push that money into the system to allow it to happen in an effortless fashion. And I'll give you one last more space-agey idea. There's a unique ability now for women living in counties where there's no obstetrician to take advantage of technologies that historically weren't widely available, like, for example, the ability to put ultrasound probes that a person who's not well-trained can just put on the belly and just move it around in a very organized way. That record goes back to the obstetrician where it's read carefully, and if that woman who is in her 8th month of pregnancy is having a problem, these simple systems are so easy to use, we can now make that diagnosis. Remember, most postpartum, peripartum deaths are caused because of prepartum problems. We didn't notice they had preeclampsia or another problem that was going to be life-threatening, and once that diagnosis is made, you can preemptively address it. Perfect timing. He is like a brother, literally, because he knows what I'm going to do before I do it, often because he's telling me to do it. Secretary Kennedy is a breath of fresh air in this space in ways that are unimaginable unless you're in this agency. Every single person up here is attracted. He's like a magnet. He just pulls people in who are good-willed and want to make a difference. And he gives you not just the ideas, but he also gives you the courage to act. Because I think the MAHA movement is defined by one primary word, which is being curious. Bobby Kennedy is the most curious person I know on the planet. He's asking questions, and they're real questions, not statements in disguise, and then he's courageous enough to act on what he learns, because sometimes you hear things that you wish you hadn't heard, and then he's compassionate enough to deliver it in a way that resonates and resounds. And for that reason, I'm always honored to call him my boss. Bobby Kennedy.
Hey, everybody. I'm really happy to be here today to be part of this announcement of Moms.gov. This is a win-win. It's a home run for both the MAHA movement and the pro-life movement, which has been asking this kind of site for almost a decade. And it's one-stop shopping for moms who want information on IVF, on prenatal care, on postnatal care, on nutrition, on baby formula, on all of the universe of concerns that an expectant mother might have, and of course on Trump RX. And it will direct people. It's a really great website, and I will quickly direct you to the answers that you need. I'm very proud to be part of it, and I'm proud to be part of an administration that wants to make America welcoming and friendly to motherhood again. We had two administrations that were unfriendly to motherhood, and now we've got an administration where we have a president who wants mothers who want babies to have them and to do everything that the government can do in its power to make that easy and an agreeable process for moms. One of the things that President Trump has me doing is looking at, we have a fertility crisis. I'm on the, by virtue of my role here as Secretary of HHS, I'm also on the board of the Social Security Trust Fund, and we have, once a year, we have meetings. And the Social Security Trust Fund does intensive, comprehensive research on fertility rates in this country because it directly impacts, the fertility rate directly impacts the lifespan of the Social Security Trust Fund and what year it's going to go bankrupt. And this year we heard the most disturbing news, the biggest drop in fertility in history. We now have a fertility rate officially of 1.57. And that's down from 100 years ago. It was at 3.26. So this is half of the rate of, less than half of the rate of childbirth that we had in 1920. And it's way below the replacement rate, which is 2.1. And it is actually approaching the rates they have in China and Japan, where there's cataclysmic predictions about the impacts on their economy. It affects our economy, it affects our national security, it affects directly the Social Security Trust Fund, it affects the Medicare Trust Fund, and President Trump has asked me to determine the cause of the dropping fertility rates in this country. So we have NIH and the other agencies doing the first really comprehensive science on that to figure out what's causing it. Why have male sperm rates in this country dropped by 50% since 1970? And why are the fertility rates dropping so fast in this country today? Why are women, and particularly young women, not having babies anymore? And we're looking at metabolic challenges which affect fertility. We're looking at obesity, which directly affects fertility. We're looking at environmental exposures like endocrine disruptors, like pesticides, microplastics, and all of the different components of this toxic soup that young women are now walking in. And we're going to find out the answer, and we're going to eliminate those exposures. And until then, we're going to give the American women, I don't know, I didn't hear Dr. Oz's entire speech. I just caught the end, but he and I have been talking a lot about the fact that Americans, one out of every 3 women in this country is short on babies. In other words, she either is having a baby that she's either not able to have her first baby or not able to have a second or third baby that she wants. It's 1 out of every 3 women. And that's something that we need to fix. It's an existential threat to our country. And luckily that we have a president who's absolutely committed to finding the answers, to eliminating those exposures, and to making America, again, friendly to motherhood again. So I want to thank all of you and thank the panelists for being here and all the hard work you're doing to make this work. Stephanie, good to see you.
We'll put Katie's spot in. Alex is not around, I guess. All right, there we are. Look happy.
Thank you. Well, wasn't that a wonderful surprise to get Dr. Oz and Secretary Kennedy here? It's just amazing to get to work with both of them every day, and they do the right thing right away, and they do it right, and that's their motto. So I get to now introduce Representative Harshbarger, who represents Tennessee District 1. For those of you who don't know, she's a pharmacist. So she has an extensive medical background, and her idea, really her bill to get this resource together for women, really it came from her genesis. And so without further ado, I'd love to introduce her. Representative.
Well, I want to thank the Trump administration and the entire team at HHS for hosting this event and for your commitment to supporting mothers and families and just the sanctity of life. Behind every life is a mother that somebody needed to believe in her first, and Moms.gov is America showing up for her. You know, I was listening to Isabel earlier, and I had to laugh. I was thinking, you know, social media tells you it's too hard to be a mama. You know, don't do that. It takes up too much time. And, you know, and I think about when I was growing up, and administrators, probably me and you up here, maybe Dr. Godsey. You know, we rode in cars, didn't have seat belts. We rode in the back of a pickup truck where I came from, and we drank out of water hose. And it's a wonder that anybody in my generation is still alive. Because if you look at how protected people are on social media. You know, I sit on Energy and Commerce, and I work with Dr. Oz, and I work with RFK, and it's such a blessing to me to be able to do these things. And the good doctor here to my right is correct. I wanted to do this because I have been a pharmacist for almost 40 years. And I've done a lot of compounding. I've done a lot of infertility work. I've done a lot of work with mothers that, you know, whether you planned that pregnancy or not, there's a fear involved. Whether you planned it or not, you're fearful if you haven't had a child. And when you're blessed with a pregnancy, whether expected or not, you shouldn't have to scramble for help. And think about this, when the Dobbs decision came down, you had states like mine in Tennessee and Riley's, we had trigger laws. So what happens when these young women get pregnant and they don't know what to do? If I have my baby, do I give it up for adoption? What do I do? There's a hodgepodge of places you can go get it. It's a patchwork of issues. to where you don't know if you go to the crisis pregnancy center, you don't know, community health centers. Where do I go to get the help? Who's going to help me? Who's going to hold my hand as I do for my postmenopausal women? Who's going to hold my hand through this pregnancy? And that's what this bill does. You know, the driving conviction behind my pregnancy.gov act are those very things, and it's why I'm so proud to be here today to launch the Moms.gov website. I'm glad that this administration had the vision and the will to build it. And let me tell you what prompted that legislation. Nearly 88% of women who had abortions in 2022 were unmarried. Many of those women weren't making the decision because they wanted to, they were making it because they felt alone. God's word tells us, don't fear. I'm with you, and I'm with you always. And I go back to what the Bible says about he knew you in the womb when he formed you. And I was telling Riley a little while ago, it is, when you have a child, it is a treasured trust from heaven to be able to take care of that precious child. And that's the way I think about it. You know, we may not be able to whisper to that young woman personally, but Moms.gov can be the hand that reaches out and says, help is here. When a woman finds out she's pregnant, especially when it's unexpected, one of the first things she does is reaches for her phone. If she's scared, she's searching. And what she finds in those first moments can really shape every decision that follows. For too long, what she found was a patchwork, a nonprofit here, a state program there, and a hotline that she may or may not get a call back from. And these things are helpful, but they're scattered. And it's hard to navigate it when you're overwhelmed. And listen, I deal with those women who are overwhelmed. If you go to an infertility specialist, they come in and they don't know when to take the temperature, what drug to take, when do they do this, because it's very critical. And as Dr. Oz said, those drugs are terribly expensive. And young women are waiting later in life to get pregnant, and that's another issue. But even when they get pregnant, you know, a lot of times it's a high-risk pregnancy. What HHS has put together here is very remarkable. I've worked on this for almost 6 years. One trusted website, it's a .gov website that carries with it the credibility and reach of the federal government, where any expectant mother can find anything she needs in one place. If she wants support services and health centers, she can find it. If she wants resources for mental health, adoption, or breastfeeding, she can find it. Information on the Trump accounts and Trump RX, and important nutrition and preconception information. This is the federal government doing what it should do, organizing what already exists and points people to it. It's just the front door, and it's one that should have existed a long time ago. You know, I'm a mother and a grandmother, and you know, it's personal to me when I see so many young people, and I've mentored so many young people. They call me Mama D in Congress, for goodness sakes. And you want to know why? Because some of my colleagues, I don't think you're one of them, but some of my colleagues are younger than my son. I've been a mother for 41 years, and I have 2 grandsons that are 11 and 9. So life is important to me. And whether I've talked to women and they've decided to keep their baby or put it up for adoption, that's a privilege for me to be able to do that. I'm still a licensed pharmacist. I still work. And I will work once I save the country. I'll go back home and I'll start to work. But this is a very important thing for me as a mother and a grandmother. And like I said, I've been doing this for almost 40 years. I've always believed that protecting life doesn't end at birth. It means walking with mothers and family every step of the way, like Tennessee with the trigger law. Look, if you're going to ask that young woman to have that baby, carry it to full term, you ought to be able to give them resources to help them raise that child the way it should be raised. And that's what this administration's doing with Moms.gov. They've taken the idea and they made it real with the full weight of HHS behind it. And I want to recognize Senator Katie Britt, whose Moms Act carried similar provisions in the Senate and whose partnership has been invaluable. This is exactly what it looks like when Congress and the executive branch work together on behalf of the American people. And in closing, you know, the MAHA agenda isn't just about eating healthy and exercising. It's about meeting people where they are and giving them what they need to thrive, including mothers who deserve to know that they're not alone, that help exists, and that their child's value has value from the very beginning. Moms.gov is a step toward that, and I'm proud to have played a small role in helping to inspire that. And I'm even prouder to see this administration carry it across the finish line. I'd love to see them carry a few more things across the finish line, and I'm working on that too. No mother should ever feel left behind or unsupported. And with the launch of Moms.gov today, we're delivering on that promise, and I look forward to continuing to fight in Congress to make sure this resource reaches every expecting mother in America. So thank you all for being here today. And God bless you, and God bless this great country that we live in called America.
Thank you, Representative. You truly are a compassionate conservative with the biggest heart, wonderful policymaker, and you are an inspiration to many. Well, with that, I would like to introduce, well, another person that no, I don't have to, because she's amazing athlete, advocate. You know how she has just moved the needle on her issues that really she's so passionate about, which she'll talk about. Riley Gaines.
Oh my goodness, well, thank you. First and foremost, I want to say I'm so proud to be a lifelong Tennessean. So thank you, Representative, for all your work representing us here in Washington, D.C. Happy belated Birthing Persons Day to all who celebrate. Think about all the names that we have been called as women, certainly, I would say, over the past 5 years until the most recent year. Menstruators, bleeders, birthing people, chest feeders. I believe Governor Evers in Wisconsin attempted to change state statute to change the word mother to inseminated persons. There's not a whole lot more dehumanizing than inseminated persons. My husband thought he was being funny yesterday. He said, "Happy first Inseminated Persons Day." I just about slapped him. It's funny now, you know, we laugh at it. We understand it to be, you know, almost comical. It's comedic relief, truthfully, is how it feels. But I think we forget that we were really the butt of this joke for far too long, even by people who were actively serving in consequential roles, such as, even in this department, the former Assistant Secretary of Health, Mr. Rachel Levine. This was real. It happened not that long ago, which makes me all the more grateful for the people who are serving you and myself. What we've seen with the launching of Moms.gov, and certainly over the past year and a half at this point, is what it really means to be pro-life and to be pro-family and to be pro-woman. It's not hiding behind euphemisms or silly slogans that actually make no sense. They say it, things like trans women are women. Think about that, it doesn't even make sense. They're just saying words, hoping that we nod along and don't really ask questions. The euphemism of it's a clump of cells, or it's just tissue, or healthcare freedom, that sounds really good, right? I like freedom, I care about my health. Where was that healthcare freedom in 2020, by the way? No, these are the same tyrants who fired healthcare workers, who fired U.S. military members, who fired school teachers for not complying with their autocratic mandates. So to see the action that we've seen, of course, it is certainly long overdue. I will tell you, we've heard lots of stats and percentages and numbers. I don't have those things, mainly because I never adequately prepare. And even if I did, I probably couldn't rattle them off without looking at my phone. But what I do have is personal experience and testimony of how motherhood has radically changed me. I believe my calling has certainly shifted over the past 4 or 5 years. I think at one point my calling was to swim as fast as I could. Really, it is sports that has given me one of the greatest gifts of my life. It gave me the confidence before I ever knew I needed it. It taught me how to be a leader. It taught me discipline and resilience and perseverance. It taught me how to work hard. It taught me how to believe and myself, I've seen how sports turns insecure girls into confident young women. Sports had opened doors for me academically and professionally and personally. I've watched girls discover themselves, courage, self-respect, all because of sports. Ultimately, it's sports that allowed me to meet my husband. He was an athlete at the University of Kentucky. We got married in my senior year, and this past year, September of last year, we welcomed our little baby girl into the world. And let me tell you how becoming a mom changed me radically, shifted my perspective on things that maybe at one point I thought were pretty mundane, I care very deeply about now. And things that at one point I cared very deeply about, now I don't care as much about. I'll never forget, and for a little context, I've always been pro-life. I feel like that's important to say. So I've always understood as a Christian that we have a God who condemns the shedding of innocent blood and who breathes purpose and value into every single life inside the womb and translated to outside of the womb. But I will never forget going to that first ultrasound appointment at 8 weeks, and you hear that heartbeat. And guess what? That heartbeat, just like yours does, just like mine does, it was undeniable life at that point. But it only, the undeniable life, it only intensified as you got further along in your pregnancy. Going to the anatomy scan at 20 weeks, and guess what? You hear the words, "It's a girl," and you see these little tiny hands and these little tiny feet. Actually, I think our little girl's feet are really big. I think she's gonna be a swimmer and tall like her dad. They were able to tell me at the time she has a lot of hair. I mean, it changes you. Then the labor and delivery process. Sounds weird, I loved it. I loved giving birth. It was the most magical, miraculous thing. And to now be 7 months into this whole mom thing is just so purposeful and rewarding. Our culture, which it's why I alluded to the ultrasounds, because I want to highlight the importance of these pregnancy resource centers and the opportunity that we're having here to be able to encourage life. That's the moment when people choose life, I think, oftentimes when they hear that heartbeat for the first time. So thank you guys for your work. Isabel touched on it, but I think it's worth reiterating as someone who is, I guess, Gen Z and involved on the online internet space, the message that young girls specifically are receiving from our culture. It's a culture that treats motherhood as a burden instead of a blessing. Marriage is mocked. Isabel actually knows this. At CPAC earlier this year, she said something to the effect of, "Get married, have kids." How radical of her, right? Well, guess what? The View went on to talk about this segment, and they said that it was reckless. That is reckless advice to be giving young women. All the while, they prop up people like Alex Cooper, host of Call Her Daddy, actually interviewed Kamala Harris leading up to the 2024 election. This is a woman who frequently, I'm not going to get into the specifics or the graphics because, again, it quite frankly feels too explicit for me to even say out loud on this stage in the forum that we're in as a fully grown adult. She frequently packages empowerment as detachment from responsibility and doing what feels good. We're told that fulfillment comes from endless self-focus or career status or casual relationships or avoiding commitment altogether. I'm here to tell you that's not the case at all. Motherhood, it's not a downgrade. It's not a weakness. It's not the end of a woman's purpose. Yes, it does change you. I'd be lying if I said it didn't. But I'm here to tell you that it changed me for the better. The version I am of myself now compared to even 7 months ago, you realize how selfish you were. I'm so much more patient. I'm so much kinder. I have more grace for my husband. I have so much more compassion because of our daughter. And I certainly look at that as a good thing. Last thing here in wrapping up, I feel as if it would be remiss in talking about healthy moms and healthy pregnancies and healthy babies to not thank this administration for the work they've done on the newborn vaccine schedule, ultimately reducing this number from 72 vaccines. That's like a chemical cocktail, if I've ever heard of it, some of which had never been tested adequately for safety, containing things like formaldehyde, copious amounts of aluminum, mercury, neomycin, et cetera, et cetera, et cetera. Thank you to this administration for providing adequate resources and information to moms like myself to help make informed decisions for our children and their health. That's what it means to prioritize our health and our well-being. Still solutions, or what it looks like to create solutions on some of these important issues, such as defunding Planned Parenthood for good. This is a sinister, profitable, billion-dollar business that receives nearly $800 million of taxpayer funds annually. 1/3 of my generation isn't here, actually, because of abortion, largely committed by Planned Parenthood. Working on women's health research, oftentimes that feels archaic and outdated. This is a huge step in the right direction. Working on healthcare price transparency, something that we have seen impact, I think especially women when they go into the hospital to deliver their babies and they're met with surprise hospital bills months and months after they welcome their baby into this world. Again, why resources like Moms.gov are so incredibly important, because what they're doing is they're equipping moms. They're strengthening moms. And when you strengthen moms, you strengthen families. And when you strengthen families, you strengthen communities. And when you strengthen communities, you change the culture. And when you change the culture, you win America. That's what this is about. So thank you guys for the opportunity to be here advocating for women and advocating for the unborn.
Well said. Thank you, Riley. Next, we are going to have the Director of Office of Global Affairs, Bethany Cosma.
Thank you so much, Stephanie. So I want to thank you, Stephanie, and Natalie Dodson, and President Trump, and Secretary Kennedy for us being here today. It's because of their leadership that we're able to meet here and talk about a culture of life versus a culture of death. As a mom of 3, supporting motherhood and uplifting moms is extremely, deeply personal to me. And it's a priority of mine, and I'm so grateful it's a focus of the Trump administration and HHS. At the Office of Global Affairs, we have the responsibility of defending women, especially mothers, from harmful ideologies being pushed around the world. Motherhood is a sacred responsibility, and a mom's role reaches far beyond her household, especially as they endeavor to nurture, guide, and strengthen the next generation. When mothers are supported, families are stronger, and when families are strong, communities and nations flourish. Unfortunately, today, motherhood is itself under attack internationally. It's heartbreaking to watch how nations around the world and multilateral organizations, in particular like the UN, are trying to erase motherhood completely. Thankfully, here in the United States, President Trump has taken steps to correct what many saw as a wrong against mothers by restoring clear language that recognizes women and mothers. On his first day in office, President Trump declared as the official policy of the United States government that there are only 2 sexes, male and female. Our office has been fighting diligently to preserve language in the international documents that reflect the truth of biological reality, and we will never, ever tire for fighting for biological truth. This includes fighting against ridiculous language like Riley mentioned earlier, chest feeding, birthing person, women in all their diversity, that diminish the value of women globally. Unfortunately, these were terms championed by the previous administration and are still being championed at the United Nations. In fact, earlier this year at the UN Commission of Status of Women, the agreed conclusions document did not even mention the word mother. In fact, some countries argued against the inclusion of references to the family entirely. How heartbreaking it is that we had to fight to include the word mother and the word family in a document about women. When we stop naming women and mothers in policy and society, we diminish the reality of biological females and the pivotal role that they play in bringing life into the world. No man has ever been pregnant or given birth. It's biologically impossible. And while we are fighting to protect women and mothers, we're also working to build strong international coalitions around the principles embodied in something called the Geneva Consensus Declaration, which was launched during the first Trump administration. One of the central themes that the declaration is the importance of motherhood, family, and protecting life. It reaffirms that the family is the natural and fundamental group unit of society and is entitled to protection by society and the state, and that motherhood and childhood are entitled to special care and assistance, and that women play a critical role in the family and make an invaluable contribution to the welfare of the family and to the development of society. Isn't that beautiful? These words remind us of something fundamental. Mothers are essential not only to families, but to strengthen this future of our societies. Our international coalition has already reached 41 nations, and our momentum is growing. By continuing growing this alliance, we help ensure a unified international voice dedicated to supporting women and mothers. I'm so proud to say that this administration is committed to restoring the recognition and respect that mothers deserve on the international stage, and we do want to make motherhood great again. Thank you.
Thank you, Bethany. Okay, we have Tonya Baker Nelson, Hand of Hope Pregnancy Center, to speak next. CEO.
Thank you very much. I am so encouraged by all of y'all. I can't wait to get back home and get to work, because this is absolutely wonderful. I've heard a ton of common sense. I've heard a ton of conservative common sense. Women are women, men are men. Babies deserve to be protected on this stage today, and we are tickled about Moms.gov. So my name is Tonya Baker Nelson. I am the founder and CEO of Hand of Hope Pregnancy Centers in North Carolina. Native of North Carolina, this is what we sound like when y'all come visit. So we have 3 pregnancy centers, and I am thrilled to be able to tell you exactly what pregnancy centers do for those of you that don't know. We offer no cost, free, no cost to that mom that walks in the door, medical services. We come alongside her. Our ultrasound, we do have medical staff full-time in all of our 3 centers. There at her disposal that she gets to talk to. She comes in and we explain to her pregnancy education, the size and gestational development of that tiny developing baby in her womb. So the ultrasound does a lot of things for us. Obviously, we look for heartbeat first. But what that does is when a woman comes in to see us and she gets a positive pregnancy test, common sense tells her that she knows that she's pregnant with a baby. But what that ultrasound does is it introduces her to her baby. And so we're able to walk alongside her during that whole process, and then we continue our relationship with her if she lets us throughout the entire pregnancy, and then again until the baby is about 2 years old with our mentoring services, also free to her. In the mentoring part of our program that we offer to her, she earns valuable, needed necessities for her baby, be that diapers or formula. We do talk about breast is best for sure. We're big on breastfeeding as well. Car seats, strollers. We actually have a program where we will allow our clients to apply for housing scholarships as well as child care scholarships, because it's very easy to tell a mom, hey, we're right here with you. We want to empower you to choose life. Go do that and let us know how it turns out. But the hard part is coming alongside her and really truly giving her that financial support that she's going to need for the first few years of the baby's life especially. So every state in the country has pregnancy centers. They're in our most populated counties. They're in our least populated counties. My challenge to you would be to go to Moms.gov and click on that option line link and find the closest one to you. Volunteers are the backbone to a lot of those pregnancy centers. A lot of us do have paid medical staff as well. But this is how we change America. This is how we make unborn babies great again, is people like you and me who come alongside our communities and our mothers and our fathers who are in need of help and need to know that we are who we say we are, and we are a pro-life country.
Thank you so much. Tonya, now we have Samantha Jo Spivey, Okay, thank you so much. Come on up to the podium. She has a 1-year-old daughter, Zoe Grace, and I think she was a recipient of Hope Pregnancy Center, Hand of Hope Pregnancy Center, good benefits. Thank you.
Yeah, so my name is Sam. My daughter Zoe, she's somewhere around here. It's hard to keep track of them. There she is when they're 13 months old, just starting to walk. But I just wanted to talk a little bit just about Hand of Hopes, about their classes, and just how they benefited me personally and all the other moms there. So I first walked in at Hand of Hope when I was about 7 weeks pregnant. I did not know what I was going to do. My mom had just said, hey, I've heard of this place, word of mouth. Why don't you go check it out? There's free ultrasounds. And I knew I was walking into a situation where I was going to be a single mom, and free sounded amazing to me at that moment. And when I walked in there, I got to meet with their ultrasound technician and their nurse as well that they had on site. Stacy was working that day. And we just sat down, we talked through all of my options and what those would look like. And after a few conversations, we had come to the result where I said, I want to at least have an ultrasound, I want to see my baby. We did the ultrasound, and just like Riley said, everything, it changes, you know? I mean, she looked like a gummy bear in my stomach at that point, but it's like, that's my gummy bear, you know? I wanna learn a little bit more about her. And so I said, okay, well, what would next steps look like? Could I come in for another ultrasound? How much would that cost? And they said, no, it's completely free. We will do as many ultrasounds as you need whenever you're anxious. She's not, you don't think she's kicking enough. Let's do an ultrasound. It's all about your comfort. And how do we do that? We partner with you through life skills classes, as they would call it. So when I explain Hand of Hope to people, I like to tell them that they partner with moms who have found themselves in an unexpected pregnancy like myself and are not financially prepared to become potentially the head of their household. When I first showed up for a life skills class, I met with Alicia. She was one of the counselors that we had there on site, and we just talked through how I was feeling, my different options, what job I was doing, if I thought about being a stay-at-home mom, all those just questions that I hadn't really even considered at 8 weeks. But it was great to start that dialogue. After a little bit of talking, we talked through the baby boutique and what those point system for that would look like for our rewards. We call them rewards because it's those little things that make you feel more prepared to be a mom and give you that little bit of excitement that sometimes you need throughout a hard pregnancy. It would come with, you could get bassinets, you could get a crib, diapers, clothes, baby monitors, everything that felt like luxury for a single mom, things I never thought I would be able to afford. All of those now were becoming possible and attainable just by showing up, having open conversations, and growing in my knowledge of what becoming a mom would look like. Those classes could be from birthing, lactation consultants, it could be CPR training. They even have fatherhood classes for those fathers that are wanting to come alongside and be part of their kid's life, because, let's admit it, I think Tom and, Jared, they both know, even fathers need a little help too. Going further through the classes, you then get to build a community sometimes with the other moms there. It's an optional community, right? After you give birth, you can either continue those classes on your own, or you have the option to kind of group up with some of the other moms there who've worked that same path and that same journey as you, and so you can start to foster relationships in that way. Those groups and those communities, we have explored different topics like all-natural products you can use for your babies, different purees that you can make for them as they get a little bit older, and some of us have even opted in to do some Bible studies together, and it's been really great and just really beautiful. After you age out of the pregnancy center at 2 years old, the care does not stop there. You actually have an opportunity as well to work at potentially a coffee shop that Tanya Nelson started herself in the Fuquay-Varina area. And it was created to come alongside moms who wanted to just dip their foot back into the working world, but didn't really know how that was gonna work, how much they could really commit hour-wise to it, and just wanted kind of that sense of normalcy back. The coffee shop there is a nonprofit, And so all donations and all purchases that are made there do go back to the pregnancy center to help those moms that are maybe struggling with housing, childcare, other areas of financial relief that they might be needing to help them succeed as their child continues to grow and as they continue to grow in their journey. It for me has been an amazing blessing, and I would not be able to, be here standing with you all today if it was not for that. I myself work at that coffee shop, and even the women there that you speak to, the customers that come in and that you get to greet, you'll be surprised at how many stories that they actually have that are similar to mine. And it has been just such a comfort. And so I'm so grateful for all of you sitting here today and just for taking time to help support women like me and those moms.
Samantha Jo, it really makes it so tangible to see it from her perspective of really what is available. That was just perfect way to end this celebration of panelists. I thank all the distinguished panelists for being here today and pouring their insight to us, and everybody here in the audience. You are our ambassadors. Go and spread the word of Moms.gov. And to all the ambassadors here, thank you for being here. And just, I believe, whether it's codifying this with your legislation or continuing our good work, thank you for being our cheerleaders. I promise you there's more to come, but this administration, Secretary Kennedy, remain committed to strengthening the support of American mothers and families, and today's launch is a powerful reflection of that commitment. Thank you all.